Good morning, everyone. Great answer. My name is Ken Rathmeyer, and I am the mayor here at the town of Bermuda Run. And it's indeed a pleasure to welcome you all to our community on behalf of our town council who's seated up here in the front, our town manager. We're certainly glad that you all are here. This is a great day. I'd also like to recognize someone special as well, the former mayor of Bermuda Run, Mr. John Ferguson, who played a key leadership role in ensuring that this hospital comes to fruition in eastern Davie County. And we thank him for his dedication, his service, and commitment to excellence in everything that he does and we do. And now, it's really an honor and privilege to introduce to you Mr. Donnie Lambert. Donnie is the chairman of the board of the Davie County Hospital. Donnie, the floor is all yours. Thank you.
Good morning. Good morning. On behalf of Wake Forest Baptist, I'd like to welcome all of you to this very important day and very important announcement. You know, it was 2007 that I actually stood here in Davie County, and I said, it's a great day to be in Davie County. And many of you remember that. That was on the occasion of the announcement of the plans of Wake Forest Baptist to seek permission to build a replacement hospital for Davie County Hospital. Now, we knew the journey would be difficult and lengthy, but little did we know the twists and turns we would face along that journey. Davie County became second home to many of us. We developed friendships that will last a lifetime. Among those friends are members, past and present, of 3 organizations whose support was essential to make these plans a reality. As I call your name, please stand and remain standing until all board members are recognized. First, from the town of Bermuda Run, Mayor Ken Rathmeyer, earlier, will remain standing. Shirley Cagle, Shirley, Ed Coley, John Guglielmi, Jerry West, Andy Jewett, Town Manager Lee Rollins. Let's give them a big hand. The Davie County Board of Commissioners, Carl Humphrey, Chair, Robert Wise Carver, Vice Chair, not here, Mark Jones, Mark, there's Mark, Richard Poindexter, Ken White, and County Manager Beth Dirks. And now a group I've really had the privilege of working with for the last 5 years, the Board of Directors of Davie County Hospital. And Dan Barrett's my Vice Chair, Dan. Terry Brawley, Terry's over here. Beth Dirks again. Bill Junker, great supporter of this county and this hospital. Steve Robertson, we're going to mention Steve's name a few times. Ken White. And from the Medical Center, Doug Nelson, Lynn Pittman, Steve Snellgrove, and Heather Hayes. You're really privileged in this county to have some tremendous elected officials. And we have 2 from our North Carolina General Assembly, Senator Andrew Brock, who's been there all along the way. Senator Brock. Representative Julia Howard, who's going to Raleigh as we break up here today. There are a few here from our Medical Center Board, or one of our entity boards, and I do want to recognize Ron Kessinger. I saw Ron come in. Ron, here. Ed Welch is over here. And of course, Steve Robertson, who has chaired a number of boards and committees over the years at our medical center. I'd like to congratulate them. And I was also going to thank Mayor Ferguson for the work you did and how you really stood by us during those early years. You did a great job, and we appreciate what you've done as well. We have a representative from Senator Burr's office. Appreciate you being here. You know, there are many others, and I could actually go through, I mean, we had hundreds of people engaged in this project, and I really wished I could recognize all of you. So just know that from my heart to your heart, I appreciate all that you've done to bring this project to this point. But I do want to mention one individual, Dr. Francis Slate, the mayor of Moxville, who has shared his vision and given us support every step of the way. Mayor, he's over here. Unbelievable supporter as well. Thank you all. On behalf of Wake Forest Baptist, we extend our thanks to each of you and everyone who began this journey with us 5 years ago. If there's one person who's held this project together through the rain, actually I could say this morning, the ice, the snow, and the storms, it is Steve Robertson. As a member of the Davie Hospital Board, the Board of Baptist Hospital, and the Board of the Medical Center, and as a proud resident of Davie County, Steve never took his eye off the ball and always kept us all moving forward. It is my pleasure to welcome Steve, who will introduce Dr. John McConnell. Steve.
Thank you, Donnie. It is indeed a great day in Davie County. Donnie's wonderful at giving recognition to others, but he really deserves a major line share credit for bringing us to this day for this announcement. Worked alongside Donnie and many others, and there was a ferocious effort, but none really participated any more than Donnie in getting the certificate of need and the agreement with the state to build this replacement hospital in Davie County. And he was steadfast in keeping our hopes up throughout the entire process, because some became doubters. Not myself, but Donnie, thank you for that. So let's give him another round of applause. I do have the pleasure to introduce Dr. John McConnell. Since he came to Wake Forest in 2008, he has led the medical center on a transformational journey, and I've been privileged to be alongside Dr. McConnell. As the first CEO of the organization, Dr. McConnell has brought together the clinical, the research, and the educational missions of the medical center, and has embarked on a strategic plan based on balanced growth. And friends, it's working. If you know much about our medical center, Dr. McConnell has been a transformational leader. Dr. McConnell is leading us on a journey that will result in a renowned academic medical center that reaches out from Hawthorne Hill and Winston-Salem to help bring the absolute best health care possible to the region. Join me now in welcoming Dr. John McConnell for a special announcement we're all here to hear today. Thank you.
Thank you, Steve. You know, Steve is required to say nice things like that. There's this psychological principle called cognitive dissonance reduction. Big word. What it means is if you buy a Buick and you're reading a magazine, you're more likely to stop and read the Buick ad to reinforce your decision. Steve hired me, he has to like it. Or it's going to produce a lot of dissonance. Welcome, everyone. This is exciting, and I certainly don't have time to thank everyone that's already been thanked, but I also want to thank Donnie. There's just no question that we wouldn't be here today without his leadership. So this is an exciting day, and although it is still appropriate to frame this project as the Davie County Replacement Hospital Plan, I hope you would agree with me that at the end of the day, in this conference, that it is actually much more than that. It is actually an integrated healthcare medical center that is tied in closely with our operations in Forsyth County in terms of advanced care, bringing as much of that advanced care as possible to the care of this community. Because in the world of value-based healthcare, which you may have heard of, it is very important that we provide care at the community level, right place, right time, at the right cost. In fact, we've thought about this in a much different way over the last year than just replacing a hospital in Moxville with one a little bit further east. It's really a different kind of healthcare delivery system. And we've been very excited over the last year in actually designing that from a patient's perspective and working out from that to the facility. And actually, the facility came only after we had a clear vision of what the sort of services we wanted to surround patients, not in just this destination, in in this county, but actually adjacent counties who will be coming to Davie County for their care. Again, a different concept than a replacement hospital for the county itself. One of the reasons we took additional time on this project is because of this concept of value-based healthcare. We actually have substantially expanded the size of the medical office building from what we announced a year ago. And I'll show you that on the plan in just a minute. And this is really just, again, sort of engineering the needs of the county, the patients in adjacent counties, and then building a facility from that as a starting point. You all know the location at I-40 and 801 is going to be extremely convenient, not just, again, for local patients, but for patients who might actually be coming from some distance to come to this facility. We are naming this campus, not the set of buildings themselves, but the campus, just to indicate how important it is to our overall system as Wake Forest Baptist Health West. This will be our West campus. So this is, again, another indication this is more than a community hospital. This is an extension of Wake Forest Baptist world-class academic medicine here in Davie County. We will decide over the next year or so before the first phase of the facility opens what the buildings themselves will be called, but the campus will be Wake Forest Baptist Health, and I hope you all will be as proud of that as we are. So without further ado, let's reveal the renderings of the facility that will be construction on in this coming month. So I'll stand over here and I'll talk as loud. Can you all hear me from the back of the room? Okay. This is the medical office buildings. This is sort of an aerial view from the intersection of I-40, 801, off the ground a little bit, looking over more or less to the north of this facility. This is the medical office building. This is the outpatient center that you may remember we were using the term HealthFlex before. And think of this part of the facility as essentially a hospital without beds. It has all the core infrastructure of a hospital, 24/7 emergency department, observational beds, procedural areas and operating rooms, imaging, etc. Everything a hospital requires except for the beds. The bed wings will be on the back side of the building. I'll talk more about that in just a second. And then this is a connecting passageway between the medical office building and the outpatient center. So essentially, with the exception of not having formal inpatient beds, when this facility opens, it will be a true medical center. And with the observational bed, we'll actually be able to keep short-stay visits, people who come to the emergency department have to have certain things ruled out overnight. They can be kept there in these observation beds. As I mentioned earlier, that one of the additional periods of time that was required was to plan this expanded medical office building. Last year, we were thinking this would only be a 35,000 square foot facility, and when it opens, it will be a 60,000 square foot facility, substantially larger. The other thing is it's essentially a one-story taller as well. This will give really nice visibility of this facility from the interstate, which actually the prior design did not have done. And we believe, and our architects, HKS, believe that the materials that have been selected for this, etc., are really a nice combination of a very modern, open design. It's welcoming to patients, but also fits into the landscape, which is a very natural landscape. And we're maintaining as many of the natural landscape features, especially behind the medical center complex, as we can, with meandering stream and things of that nature that will give it almost a park-like environment to this facility. So we're very excited about this. The medical office building will be finished in the summer of 2013, and the rest of the complex will be finished in late 2013, probably commissioned and occupied in early 2014. And as you know, we cannot bring the hospital beds online until 2017, so that's still going to be in planning until probably late 2015 before we complete those final plans. So the medical office building will be open a few months before the actual outpatient center will be, but actually the MOB itself is a self-contained facility, so we'll be able to offer a full range of typical medical office type programs in that facility before the other complex opens. So once again, we're extremely excited about this project, not just because bringing the services to Davie County, but also this new way of thinking about delivering health care in a very comprehensive way and tying together this facility with our other facilities throughout the region. The outpatient service building will be just a little over 100,000 square feet in 3 levels. We anticipate that once this phase is fully activated, there will be roughly 200 employees out here when things are completed. As I mentioned, the architect is HKS out of their Richmond office. The landscape architect is Stemmel Associates from Winston-Salem. The consulting engineer is Leach Wallace from Charlotte. And the developer of the medical office building, the Summit Healthcare Group, Winston-Salem, are actually also helping us develop the out parcels for more commercial mixed-use development. That area will be called Riverville Commons. So again, we're very excited about this project. We're convinced that once this project is underway, that it will attract additional interest in the development of those out parcels along I-40. And I see Mr. Joseph in the audience here who might be willing to talk to you more about the interest, because we're hearing substantial interest in the further development of those out parcels as well. So without further ado, I'd like to introduce Mr. Terry Crowley, who's the president of your Economic Development Corporation. I must say, in my dealings, if you will, in the greater Piedmont Client area, Terry is a true leader. He's a leader beyond Davie County and is viewed by his economic development peers as the best of the best. Terry?
You know, Donnie said, maybe we should have a t-shirt that says, what a great day to be in Davie County. On behalf of 41,000 people, would you help me thank the medical center for their commitment and for their steadfastness in this entire project and building a state-of-the-art hospital in our county? Would you help me thank them? Dr. McConnell and I talked briefly before this morning. We talked about America in terms of rural hospitals and in terms of the crisis that most rural counties face today. As our own county faced this same dilemma. And as Mr. Stockard would tell me just about every year, Terry, do you realize how much money we're putting in this hospital? We probably put in $500,000 a year for about 7 years. So we found the right partner to help us out of that. So we're deeply indebted and greatly thankful for what we're able to do. I want to also thank Wayne Thomas, and I know he's a modest guy like me, but this facility, Windmont Barn, being here is just such a great asset for events like this. And would you help me thank Wayne? This is a Thank you very much. You know, most of all, what I really want to do is thank our citizens. Can't tell you how many phone calls that I got and said, Gary, do you really think they're going to build something? Well, they're building something in Clemens, and we haven't got ours. But I want to thank them for their trust and for their faith in the leadership that delivered this project. So thank our citizens for being so patient today. What a great opportunity for us to partner with one of the best academic medical centers in the world, in our community. And they also are going to represent one of the largest single investments that any corporation has made in our community, and that is over $80 million just in phase 1. So we're deeply thankful for that. I want to thank our hospital employees. Our hospital employees, through all the things they read in the paper, the ups and the downs, were steadfast, delivering quality health care to our patients, to our citizens throughout this process. And I know that they were given an opportunity to hear this announcement this morning, so thank you, Don, for that. This is a major step forward today in securing high-quality health care for our citizens without a cost to the taxpayers of this county. Would you help me thank the medical center? You just don't know how big that is, that we're doing that with somebody else's money. What a beautiful design. What a great asset. And Joe, what an opportunity for us to recruit other commercial establishments and grow the economy. And not only that, to bring new families to our communities that are going to be doctors and technical people and support folks for this hospital they're also going to be assets for this community that will also give up their time and value. So there's a great opportunity there in terms of bringing those jobs to our community. I just want to say one last time, thank all these boards for your trust, for us to get to this day. It is a big day here in Davie County. And I want to thank again the Medical Center, our citizens, for this special day. And Dr. McConnell, we just can't wait to see some dirt move out front. Thank you very much for being a part of this day.
Thanks, Terry. You've represented the face of Davie County in many meetings we've had. We thank you for your friendship and what you've been able to do for moving us forward as well. This does conclude our formal part of the program. This is a new era in healthcare in Davie County, one that I think you all, because you're here, you share in that excitement with us as well. Now, for the media, Dr. McConnell's available for questions. He's going to be in Yadkin 2, just down the hall, so if you'll go out and down the left, Dr. McConnell will be down there and be able to answer some questions one-on-one for those from the media. Thank you all for being here, and again, it's a great day to be in Davie County.
Morning. Doing all right? Yes, sir. How about yourself?